So let's get into talking about the shoulder. So what is the rotator cuff? When we look at a shoulder, we think of like a ball and socket joint. And the rotator cuff is made up of 4 muscles that reach around and kind of hug the ball to hold it in the socket and to help stabilize it. So when we think of the rotator cuff, we're thinking of those 4 key muscles that stabilize the shoulder or glenohumeral joint. And when we say the shoulder glenohumeral joint, we are talking about that ball and socket. So my trusty little piece of bone here, you'll see how there's this little rounded part here. That's the socket. And this right here is the ball. And I'm going to show you some more on this in just a moment when I can open up the screen and show you a little bit more closely there. But when we're talking about the shoulder, we never just look at that ball and socket joint. We have to look at all of the parts that work together. So when we look at, this is Pete, by the way, he's our COVID-ready skeleton ready to go. And when we look at the shoulder here, all right, so here's the shoulder. All right, you can see how that moves. When we look at the shoulder, we're not just looking at the ball and socket joint. We're also going to look right here where the neck is. We're going to be looking at this collarbone. And as he turns to the side, you'll see that collarbone comes and attaches to the shoulder blade. And the shoulder blade rests on the ribs. So when we're looking at the shoulder, we have to look at how all of these work together. So when we say the neck, we actually mean the neck and the spine all through this area, because a lot of the muscles that control the shoulder attach to this part of the spine. Now, I'm going to do my best to turn on and off the PowerPoint presentation so you can see things a little bit closer here. So when we're on here, again, there we go. This is the socket right in here, and this is the ball. So that makes up the true shoulder joint. We have the collarbone. As we follow this collarbone around, you see it attaches to this little bone on top that is actually part of the shoulder blade. Now, if you notice, there's a little space right in here. And we're going to talk more about that space in a bit. But it's helpful to kind of see that when we're looking at the shoulder, you can't just look at the ball and socket. And a lot of times, if you get an X-ray or MRI, they're just looking at this little part right here. And what we've got to do is make sure that we're getting in all of the parts that are involved. So we can't just look at the shoulder by itself. We have to look at the shoulder blade, the ribs, the neck, that collarbone in the front, and the spine through here. So when we're looking at that, a lot of times people ask me, well, what does all that other stuff matter? Well, when we look at a shoulder, the shoulder doesn't have a lot of stability on its own. It attaches to the shoulder blade, and the shoulder blade rests on the ribs, which attach into the spine. So if any one of those things along the way is having an issue, it can affect the mechanics of the shoulder and how it works. So thanks to Pete, we're going to get back to going through the PowerPoint. But if at any point you need to see something closer, definitely just raise your hand or just pop in that chat box and let us know. And Danny will have me get back on track there. So what we're going to talk about next are the main causes of your shoulder pain. So when we look at shoulders, there are a lot of things that can go on with a shoulder. There are over 20 different muscles that attach to the shoulder blade alone. So if you imagine getting 20 people to work together to do a job, that can get a little complicated. So when we look at a shoulder, if one of those muscles is not doing its job, maybe one's being lazy and another one's being bossy, it's going to throw off the mechanics of how the shoulder functions. So even though there's a lot of different muscles, ligaments, tendons, joint capsule, there's a lot of, and nerves, a lot of different things that can go on in the shoulder, we're going to go over the top 3 things that we see most people struggle with today. And then we'll have time for answering questions about some of the other things at the end as well. So one of the most common causes of shoulder pain is having a problem in the neck, all right? A lot of the muscles that attach to the neck also come down and attach along the collarbone and the shoulder blade. And if there's something going on in the neck, a lot of times you'll see someone kind of shrug their shoulder up or try to protect it. If something's going on in the neck where you get muscle guarding, that's going to change how you use your shoulder. If you have something called a pinched nerve in the neck. Have you all heard of a pinched nerve before? Yeah, I see some heads nodding. When you pinch a nerve, the more you irritate a nerve, the farther down the path of that nerve you'll feel symptoms. So if someone comes in to me and says, you know what, I've got this shoulder pain, but also I've got this aching in my thumb or my fingers, then we know that that means we need to check the nerve all the way up to where it originates in the neck. So you can either have a pinched nerve that can cause pain down in the shoulder, or if you have a kink in the neck or a problem in the neck, that can change the way you're using your shoulder, which can create more wear and tear and some secondary problems into the shoulder. Now, the second thing that tends to happen that gives shoulder pain is something called impingement. So when we look at impingement, impingement is a fancy way of saying you're pinching on something. We have to use the big word so we sound smart. But if you notice right over here on Skinny or on Pete, we've got this little space in there, all right? That space, and you can sort of see it, I put a little rubber band here on this one. That rubber band, you know what, I think this might be easier to show you. Here we go. So where I've got this little rubber band, that's where part of the rotator cuff goes. It comes through that space, through this space. So if you can see, if something happens, it's closing the space. All right, do you see how it's not too hard to get that pinched right underneath that little roof of the shoulder? So it's a little easier to see on this side. If you have good shoulder mechanics and we're moving the shoulder in the correct way, I'm going to move this over so you can see a little better. All right, when the shoulder joint moves, okay, you see how it comes up? If everything's moving the way it's supposed to, we maintain that little space right in here, okay? If something happens, maybe you have a bone spur under here, or maybe you have some not great posture, or you have the shoulder blade tilting forward, or maybe you're a little off on the muscles and that ball is sitting forward in the socket. You can see how when you try to move, it's going to pinch down on that space and ultimately pinch down on some of those rotator cuff tissues, okay? So when we talk about impingement, that means that the way that you're using your shoulder, your body's not keeping the ball centered in the socket to move. It's shifted forward to where it pinches when you try to lift the arm. And this is that space where it pinches in. So a lot of times I'll have someone tell me that they've had an x-ray or MRI and that it shows bone spurs in here. Well, if you have that bone spur and you bump into it, it's going to hurt. But if you're where you're supposed to be, then as you move, you're not touching the bone spur, it doesn't have to give you pain. So just because you have some issues going on there, most of the time, if you can retrain how to use the arm, then you can be able to move comfortably without it pinching up under that bone. So that's what impingement looks like. And okay. Okay. All we see is the slide. Mark, are you able to see the skeleton right now? Okay, I see a couple things, but okay, good. All right. I'll try to make sure and bounce back to the PowerPoint so that you can see either the skeleton we're looking at or the screen share. Okay. So other things that tend to cause pain in the shoulder. So we've talked about the problem in the neck, whether it be because of faulty posture or things pinching on the nerves or where the muscles attached from the shoulder to the neck, having a problem there. The second thing that we can see is impingement, which we just went over, where you're pinching down on that on those susceptible tissues of the rotator cuff. And the final thing that we see that can be a significant cause of pain in the shoulder is poor posture. And I know a lot of times people tend to think, well, posture, that sounds really hard, that I have to have super good posture and pull my shoulders back and sit up straight all the time. In reality, we want to look at how it's affecting the shoulder and what are some ways that we can make things easier on you. But if we look at this skeleton from the side here, all right, if his posture is, whoa, if I don't knock him over first. If we come back and look at the skeleton, what are you seeing, Danny? Oh, screen. How do I show? Oh, I thought I had it down. We'll go back to the screen. We're screen sharing. How do I stop screen sharing? Stop share. There we go. Okay, so we're back to looking at the skeleton again. And if he's nice and upright, you can kind of see there's a little space right here. All right. If he's slouching forward, do you see how now that arm starts to hang forward? And it's a little bit tough to see. There we go. If he's slouching forward, it's much easier to start rubbing under that shoulder blade. It puts a lot of stress on these muscles back behind the neck and the shoulder. A lot of times people will tell me they have knots in their shoulder, kind of right in these muscles on top between their neck and their shoulder, or they'll feel like a burning pain in the back, or they just get really tight in the back of their shoulder. A lot of times, if you tend to have a forward-leaning posture, then not only are you putting stress of gravity through all the muscles in the back, you're also going to be putting stress of stretching on the rotator cuff and parts of that joint capsule in the front, because everything wants to, gravity's trying to pull that shoulder forward. So getting that posture more upright allows the correct muscles to do the correct job versus the wrong muscles having to kick in and be supporting the shoulder in a way it's not designed to take. So those are the three most common causes that we tend to see of shoulder pain. Let's talk a little bit about what we'll be able to start doing with it. So this is Danny and his family, and we went through this last week. I don't have the picture pulled up of Camden. His baby is actually now 4 months old, and I still have the picture of him from his ultrasound in there. But they have a beautiful family, and Danny is one of our physical therapy specialists that specializes in shoulders. He was actually treating a shoulder, which is all the way up until lunchtime today, which is why I'm the one presenting today. But a little bit about Danny, his background. He actually has a lot of great training from one of the hardest institutions in the country when it comes to being very specific about treating orthopedic conditions such as shoulder pain, knee pain, heel pain, spine problems, that sort of thing. So we're very blessed to have him on board. And one of the things that we look at with bringing Danny on is he sat in front of a board of 3 to 4 advanced practitioners to be drilled and examined on all of those, and has come out on top as one of the best in the country there. So we're very glad to have Danny on board for treating shoulders. My name is Alaina. That is my dog Murphy right there with me. I'm not sure why he's sticking his tongue out, but he is. I also have quite a bit of training in orthopedic manual therapy. I'm a board certified specialist in orthopedics, and I've completed a 5-year fellowship in orthopedic training just to be able to do these types of things. But the reality is if people ask me what I do for a living, I tell them I'm a body mechanic. I help this amazing machine that is the human body to move better, feel better, and be better. So you may have noticed that the shoulder is a little bit of a complicated joint to work with. So if you're wondering why I have all these letters after my name, PT, DPT, C, blah, 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 all the alphabet soup going on, basically I have a lot of training in how these other areas, not just the shoulder, but how the shoulder works together with the neck, spine, and these other areas. And that's what makes it a little bit different to coming to someone with the level of training that Danny has or that I have. So when you ask, well, who's this person to be telling me about shoulders? Well, we each have over 15 years of experience doing this. And given the complexity of shoulders, we've developed a reputation of treating the things that no one else was able to get better. And shoulders tend to be a little more complicated. So we have a lot of people who are coming to us for that particular reason. So aside from us being very well qualified in treating and looking at shoulders and determining what's going on with them, a lot of people say, well, Alaina, that's nice, but what about my shoulder? Can my shoulder actually get better? Can my shoulder get relief? Well, that's what we're going to go over next. We're going to look at, is your pain reproducible? Do you have an activity that you do during the day or during your daily life where if I reach in the back seat of my car or try to scratch my back or fasten a bra strap or tuck my shirt in the back, do you have an activity throughout your day that you notice this makes my pain worse? If you do, that's actually a really good sign, because if your pain is reproducible, it is reducible. Meaning, if we can find the thing that causes your pain, then we can address the thing that's causing your pain. So I want you to open up the chat box and put this in there. I want you to notice in the past 30 days, what is the worst pain that you've had? If 0 is no pain and 10 is so much pain it feels like you've been mauled by a bear. On that scale of 0 to 10, what is the worst pain you've had in this last month? And if you'll pop that in the chat box. Danny, I don't have a chat box still, so you'll have to let me know how that's coming. Okay, some 7 out of 10 pain, 5s. So it sounds like in the last month, you've had a few things that have bothered your shoulder. I want you to now think about, what were you doing when the pain got that bad? What activity were you doing? And if you'll pop that in the chat box. Okay. So we've got a few things going on for people that are causing pain. Let me show you what the common ones are that we tend to see. Reaching overhead. This usually looks like if you're either trying to wash your hair, fix your hair, if you're trying to put dishes away into the cabinet, that can give some discomfort. Carrying things such as the groceries, and I'll tell you, the hardest thing to carry if you have shoulder pain is a grandchild, because man, they wiggle and they don't hold still. That makes it a little bit tough. All right. Also, we'll see if people are trying to lift a weight, whether it's weightlifting in the gym, whether it's trying to pick up, like I said, a grandchild, or just carrying things in from the car or around the house. Trying to reach behind your back, such as we talked about with scratching or washing your back, fastening a bra strap, or tucking in your back of your pants can be difficult. A lot of times people will tell me, especially if you've got kids or grandkids, reaching into the back seat to handle something with one of the kids can be really tough on a shoulder. Getting dressed. I will tell you a little trick. If you are going to be getting dressed and you're having trouble with the shoulder, actually, I'll show you that one in just a moment when I take the screen share off. Getting dressed can be uncomfortable. Also, sleeping is a pretty uncomfortable thing. And Danny, if you'll remind me to include how to put on a jacket when we do our sleeping section. All right. So these are some of the common things that we see people have problems with that will bother their shoulder. Now, the single biggest mistake that people tend to make when it comes to shoulder pain is they ignore it. Is anyone in here guilty of ignoring their shoulder pain? Yep. Richard's raising his hand. We see that pretty often where this usually comes in the form of an excuse, where someone will say, it's not that bad, maybe it'll get better with time, or it's not really stopping me, I'm just going to wait until it's bad enough where I have to do something about it. We see all sorts of reasons that people might ignore their pain. Typically, this results in it getting worse to the point where you just can't use it or lift it at all. And I will tell you, it's a lot easier. Have you ever heard an ounce of prevention is better than a pound of cure? It's a lot easier to take care of these things when they're smaller rather than when it's a larger problem. So again, when it comes to shoulder pain, there's ultimately 3 things that you can do. You can ignore it. I love this little picture of the monkey pretending there's no problem. You can alter it. Altering it typically looks like comes in the form of addictive medications, painful injections, or expensive and oftentimes ineffective surgeries. So when we look at altering it, those are typically things that are not addressing the root cause of the problem. They tend to say, oh, it hurts, I'm going to take some medication. Well, we know that about 1 in 3 people who are on pain medications, such as hydrocodone, Vicodin, OxyContin, those types of medications, 1 in 3 people who are on those for more than 5 days will likely develop an addiction issue, and that can create a whole set of problems on its own. Finally, you do have the option to actually handle it. This involves getting to the root cause of the problem and addressing it. And I can't tell you how many times I've had someone come in and maybe they had a surgery for a shoulder and they went to the doctor and said, my shoulder hurts. And they kind of pointed to the shoulder area. And so what did they do? They got an MRI. And the MRI showed, oh, you've got a bone spur right here. So that must be the cause of your problem. And they go and they have a whole shoulder surgery to get rid of a bone spur. And they come out and they have the exact same pain. That's because if you don't check the other structures that are involved to find out what the root cause of the problem is, not just what looks bad on a picture, if you don't get to the root cause of it, then oftentimes you might be fixing something that's not actually causing your pain. So something to be thinking about there. I generally recommend trying to get to the root cause of the problem before looking at surgery, medications, or injections, because if not, then you're getting a moderate fix without actually fixing the problem, and you can likely do more damage in the long run and end up with more problems. So let's talk about what successful treatment looks like with physical therapy. Now, I will tell you, I'm a physical therapist. I've been doing this since early 2005, so is Danny. We've been doing this for a while, and what we've found and what the research is showing is that you're going to do better in the long term taking the conservative approach rather than jumping straight to a surgery, injection, or medication. So what physical therapy looks like. I'm going to tell you the most important part of a physical therapy visit is the assessment, okay? If you're in a boat that's sinking, do you want to spend your time bailing water out of the boat, or do you want to find the leak, plug it, and actually, then you can manage things without the problem continue to advance. So I'll use that analogy to let people know that if you're not getting to the root cause, then you're not likely going to be making a lot of changes in your overall problems there. So the most important part about that first visit is to very specifically find what is the tissue that's causing the pain, is there damage and how much, and why is there damage? So for those of you who, sometimes people tell me, you know what, oh, I was serving, playing tennis, and that one time I went over and ouch, it hurt and I had an injury. Sometimes people will tell me, you know, I work a desk job and I really haven't done much with this shoulder, but it just started hurting. So for those ones that had it kind of came on over time without a very clear cause, those are the ones that are most important to really find, why did this break down? Why are you having problems? And be very specific on what's going on there. So without specifically understanding the problem, you can't really specifically address it. So I have a lot of times people say, oh, well, I tried physical therapy 10 years ago and they gave me a handout and said, here's your exercises. And it had 10 things to do and you did 3 sets of 10, 4 times a day. Well, I'll tell you, physical therapy has evolved quite a bit since then. What we look at now is instead of giving you a lot of exercises to hopefully somehow catch what the problem is, what we found is if you're doing a lot of exercising and maybe the ball is not sitting where it's supposed to be in the joint, or maybe your shoulder blade doesn't have good control, then what happens if you're just exercising it is that you'll tend to get stronger at being bad. If you've ever heard the expression practice makes perfect, well, we're not looking for practice, we're looking for perfect practice. Because if you're not able to control the motion well and strengthen the correct motion in the correct directions, then likely you're just getting better at being bad. So while strength can be a component, typically what we find, it's more in the way you're using the joint, and it needs a little bit of retraining there. And the easiest way to do that retraining is for us to actually get our hands on there and position the joint in the correct position in the right place, and then help it move, and then help you to be able to do these motions without pinching up or putting strain on tissues that are not supposed to take it. Now, sometimes you'll have some of these muscles in the chest or in the neck that tend to be tight. And if one of those is tight, it's going to pull the whole shoulder blade into a position where that roof of the shoulder is more likely to be bumping on the ball and socket. So what we look at is getting our hands on and actually moving those tissues, releasing the soft tissues and getting the joints moving the way they're supposed to is the first step, because you just trying to figure it out on your own can be pretty tough. Whereas if we can do it for you and help you move that way in a more normal fashion, it's a lot easier to figure out the correct way to move. And after that, once you've got the correct way to move, then 2, maybe 3 strengthening or stabilizing movements are good for you to be doing. But notice how exercises come kind of at the bottom of this list. It's not as important as being specific on what needs to be treated and getting your hands in there to help it move appropriately. Finally, there's something we do called static ultrasound. If you're familiar with ultrasound, we're not looking for babies in your shoulders here, but we do know that we can take an ultrasound unit and put it right on, once we've determined the specific tissue, we can put it right over that tissue and help your body to focus where the healing is happening. Instead of just sort of doing a little bit and hoping for the best, we can tell your body and direct it very specifically, this is the tissue that needs the healing. And what that ultrasound does is it changes the polarity there so your body will lay down extra scar tissue and some of those healing factors in that particular position. So how do you know when it's time to do something about it for your shoulder? You've got to ask yourself, are you ready for an actual answer? What is causing my pain? What is causing my problem? Are you ready to get out of pain? This may seem like a rhetorical question, but I do have some people who tell me, oh, I've got other things going on, or oh, it's not bothering me that bad, where I don't really care if I have pain. I don't have a lot of people say, most people tell me they'd rather not have pain, but when you're ready to actually do something about it to turn that pain off is when you would give us a call. Also, you may have noticed Danny and I are, our clinic makes up the most highly credentialed and skilled center in this region as far as physical therapy practices go. So if you're ready, not just to go through a standard course of care and hope for the best, but get that high precision of assessment, high precision of treatment to get you moving better and feeling better in the fastest way possible, that's when you would give us a call. And of course, if you want or need the best, that's when you would be giving us a call. So you've got to ask yourself, what are you going to do next? Let's pause here for a moment and look at your actual shoulder. So I want you to try something for me. I want you to take your arm carefully. We're not going to push into a lot of pain here, but take your arm and reach overhead. Okay? Do you notice when you get so far, it doesn't feel so good, does it? All right, let your arm back down. So arms are down. Now I want you to slouch. Now try reaching that arm up. Does it work better or worse? Yeah. Some people it's about the same. Some people it's going to bother it. Now I want you to bring your breastbone and bring it up under your chin with some good posture. And now try raising the arm up and see if that feels any different. You may notice for some of you, you can reach a little bit farther. Now, be careful with this one. Once you bring your posture up a little bit, it gets the shoulder blade out of the way. You'll notice you can move farther, but it may be a little sharper pain at the top. So please don't push into a lot of discomfort there. So these are some things you can kind of start to be aware of, that there are other things in your body besides just the shoulder that are going to create some of these issues. So you've got to ask yourself, do I want to ignore my pain and let it keep going? No. I see Sandy shaking her head there. Do I want some addictive medications, painful injections, or surgery? Most people I talk to say they want to really try to avoid surgery. And I don't blame them, because patients that have had a shoulder surgery experience a lot of pain. It's one of the more painful conditions that we see. And I'll tell you, a lot of times I host these classes in person where we have a group of about 10 to 15 people in our education center, where we go through and we bring up a volunteer and we go through, here's how this moves. And I ask people when I'm in these bigger groups, and I say, you know, do any of you know somebody who struggled with an addiction or problem with opioid medications. And I'll never forget the first class I did for this particular workshop was in August. And this woman raised her hand, and her son had died from a prescription overdose of hydrocodone. And it wasn't that he was a bad kid. It wasn't even a kid. He was in his 30s. It wasn't, when we see people who struggle with this, it's not what you think of as like a drug dealer on shady side of the street saying, give me some drugs. These are people who are in pain and have an actual problem that they're just seeking relief from. And we want to be careful about what the true cost of that relief is, because when we look at these opioid medications, East Tennessee is one of the highest in the country for opioid medications, to the point where for every 100 residents in Tennessee, there are 97.5 prescriptions for pain medication written every month. That's either month or quarter. But imagine if 97% of the people in our state are getting pain medications. What's that going to do for safety with driving, for people to be able to function well? Looking at the pain medications, they're there to help you navigate the solution. They're not the solution in themselves. So the pain medications are never a long-term solution. And we've got the American Medical Association telling us, we've got pain specialists telling us, we don't want to depend on pain medication as a long-term solution. Eventually, it becomes less and less effective over time. And you have so many other risk factors that can literally kill you if you're not careful with it, that we really would rather you actually get a handle on the condition, get to the root cause, and start to make changes there. So I will tell you that Danny and I, we love what we do, and we love to work with people who are more proactive at doing things like this, like sitting in on a webinar to learn about your shoulder and what are some of the problems that you might have and how to address them. So for people who attend our workshops, we actually offer a free 20-minute consultation. It's just, we're not able to do any treatment during that consultation, but just to help you find out what the cause of your pain is and what options look like for you to be able to do something about it. So if that's something that you would like one of the consultations, just give us a call. Landon and Sam are at our front desk. They'll always be able to just let them know, hey, I sat in on the webinar. I'd like to use my free screen or my free consultation, and they'll get you set up for a one-on-one appointment with either me or Danny to look at your shoulder and help you determine what's going on there. And what you expect with a one-on-one time there, it is one-on-one time with a specialist, someone who knows a lot about shoulders and how to be handling them. We will go in, we'll see how you're moving, we'll listen to those cues for what you tell us about what your shoulder story is. What has it been through? When does it bother you? And we'll get in and get some hands-on assessment where we actually check the joint, check the collarbone, check the shoulder blade, check the ribs, check the spine, and see what are those influencing factors that might be keeping your pain from just getting better on its own or healing up properly. So that one-on-one time to really identify what the cause is what we're mainly focused on. And then we'll let you know, here's what treatment would look like for you. Here's what your course of care would likely involve. Now, you may have seen me when we first got on here wearing my wonderful little mask for our COVID safety. For the foreseeable future, until the CDC tells us otherwise, we are wearing masks. All the therapists are wearing masks. We encourage our patients to wear masks. We actually have 3 separate gym areas where at this point we're just keeping 1 patient per gym area unless you're here with a relative that's also being seen. Then we treat you side by side, because if you're already living together, we're okay with you hanging out together in the facility. But we are taking extra precautions above and beyond what the CDC is recommending for COVID. So we have some people who are still in a high-risk group that maybe their doctor has said, give it another month or 2 before you get out of the house. For those patients, we offer, just like we're doing now, something called a Zoom session where we do an online visit. And the difference between in-person and online, the difference is being able to get our hands on it, but we can tell with about 85% certainty what's going on there just by watching how you move and instructing you on those certain movements for us to be able to assess what's going on with the shoulder. So if it is something that you're not ready to get out of the house, we do offer online visits. And if you need to become a patient for that situation, every insurance company that we work with is now covering online visits the same as in-person visits. So your insurance does cover those. Now, I'll leave our phone number here at the top in case you want to write that down so you'll know, have our number to be able to give Landon and Sam a call if you'd like to get set up for your free consultation. But I'm going to go over a lot of the things that people tend to ask us for questions, and then we're also going to go over how to safely put a jacket on and off, how to sleep comfortably, and a little exercise you can start to look at for taking care of your shoulder. And then we'll open it up for any other questions that you might have. Excuse me. So a lot of times people ask, is physical therapy covered by my insurance? Most insurances do cover physical therapy. We are in network with Medicare, Blue Cross, and some Okay, I apologize for the noise. We're getting a new air conditioner installed in our roof. So if you can't hear me, then let us know and I'll try to speak up a bit. We are in network with Medicare and Blue Cross. We also work with TRICARE if your doctor recommends physical therapy for you there. For patients with UHC, Humana Gold, there are a little bit different things for coverage there that we'll actually call and check on that for you. A lot of times people ask if I need a prescription or a referral from my physician. The answer is in Tennessee, no. In Tennessee, you can actually come straight into physical therapy for us to do the assessment. Then we actually send all of our findings over to your doctor so that your physician is aware of everything going on. And if we do need to send you in for an X-ray or MRI, then they've got the information they need to get that covered and get that started. But we do want to stay in communication with your primary care physician so we're all on the same page with what you've got going on. But in Tennessee, you can actually come straight in and then we just send that note to your doctor to sign off on from that point. Now, this is a fun question I get a lot of times where people will say, is my shoulder pain due to my old age? And I tell them age is not a diagnosis. It's just the number that's on your driver's license. So as we age, you may have more opportunities to hurt your shoulder. You may have more problems with arthritis and some wear and tear, but it doesn't necessarily mean that it has to hurt. So that's where it's beneficial to get in and actually test the tissues. I can't tell you how many people, and we see this with knees a lot, where someone will have some knee pain, but because they had an x-ray at some point that said, oh, you've got arthritis, then everyone just assumes, sorry, you have arthritis, you have to stay in pain. And I'll tell you, about 90% of the knee pain we see is we can turn off that does not have to necessarily do with the arthritis. So when we look at having knee pain, just because you have arthritis does not mean that that has to cause pain. Same thing in the shoulders. Just because you have arthritis does not mean that that's necessarily what's causing your shoulder pain. So that's where we've got to be specific. So people will ask me, well, if I know I have arthritis or bursitis or bone spurs, is there anything you can really do? And the answer is absolutely. When it comes to arthritis, if you have arthritis at any point in your life, for the rest of your life, it's going to show up on your x-rays. However, it doesn't mean it has to give you pain. If you can get the joint moving appropriately with good control, and it's not actually, the bone's not rubbing up against anything, then it doesn't have to hurt. So that takes a little bit of training and some hands-on work, but it's not too hard to get relief with that. When it comes to bursitis, have you ever heard of a bursitis in the shoulder before? A bursitis is never the problem. It's always a symptom. So it takes abnormal forces and rubbing through the bursa before it's going to develop a bursitis and have problems there. So when we look at bursitis, again, it's not hard to settle down if you stop doing the thing that causes it. And that usually takes like 2 stretches and 1 exercise to get that taken care of. Bone spurs, you might remember when we talked about, so if we've got the roof of the shoulder, right? Here we go. If we've got this little piece of the shoulder that makes the roof, if there's a bone spur pointing down off of that, well, if you're running into it, it will hurt. But if we've got the ball in the socket where it's supposed to be, you can move without ever touching the bone spur, and it doesn't have to hurt. So that's on an individual basis that we have to actually go and check where the where in your motion that the ball is bumping into that, or if it is or not. So when you have those things that we often see, they sound a little bit like a death sentence for the shoulder. It does not mean you have to have pain with them. It just means you need very specific training on how to fix that problem, and so you're not having to have pain. When someone tells me that along with their shoulder pain that they're having weakness in their shoulder, arm, or hand, there's two different things that can cause that. The number one thing we see is whenever you pinch on the rotator cuff with an impingement, or if you're putting stress on a tissue that has a small tear or is not working well, your body tends to protect itself, okay? It will lock down and it'll say, oh, nope, I'm not gonna let you move that way because it's going to hurt. So that's what's called pain inhibition. Your own body is stopping you from doing something that it thinks is going to hurt. The other reason you might have weakness in the arm, do you remember us talking about the pinched nerve at the neck? Well, those nerves send messages down your arm to say, squeeze 10 pounds. Well, if there's something pinching on your nerve, whether it's at the neck, shoulder, or farther down in the arm, that can disrupt the message from getting from your brain to the muscle. When that happens, if there's something disrupting the message, you may be thinking squeeze hard, but your muscle gets half the message and you get a wimpy squeeze. So that weakness in the arm, shoulder, or hand could be due to a nerve, or it could be just due to the pain of turning on that muscle might exacerbate your issue. We are about to cover sleeping positions for shoulder pain as well. I do have people ask me this a lot. Do I need surgery if I have a torn rotator cuff? Well, I saw one 2 days ago, a gentleman who does a lot of heavy lifting for his job, working in contracting. And he actually likely has a very large tear in there. But guess what? It's not in the way. It's not stopping him from doing what he needs to do. It actually turned out that he did have a tear from like 15 years ago, and that it had healed up as best as it was going to. He actually just needed a little bit of work on his shoulder blade to allow the shoulder to move normally. And that actually we were able to take care of in most of his first visit. I had a gentleman also doing farm work where he was managing cows and carrying heavy things all the time. We actually got to look at his MRI, and it was a complete tear on his rotator cuff. And we worked on him for about, I want to say it took 5 or 6 visits. And he came in on his 6th visit and says, hey, I got a phone call from my doctor's office asking if I still wanted to do that surgery for my shoulder. And I said, well, what did you say? And he answered the 2 questions that I asked him before. Are you having any pain? Are you having any problems? If you're not having pain and you're not having problems, you can do all the things you want to do, I would not suggest surgery. So I actually talked to him, let's see, it's May. I talked to him at the end of April, and he's still doing just fine. With just a little bit of training, by being specific, it's not about what looks bad, it's about what's actually causing your pain or your problem. And by being specific, a lot of times you can settle those issues down pretty easily. Now, how long does treatment take? This depends on what you have going on. I have some patients who are done in about 4 visits. I have some patients who are closer to 4 to 6 weeks, depending on how much damage that needs to be managed. Would you let them know we're on a call right now? So also we look at, people ask me, does it hurt? All right, let's answer that question right now. PT does not mean pain and torture, okay? If something hurts, it means something is wrong. It means you're pinching on something, some tissue is taking stress or strain that it's not designed to take. So if you're really specific with what you're treating, you can treat the tissue in a pain-free position where you're just starting to get it moving. I know 10, 15 years ago, if someone had a shoulder problem where they couldn't get the arm up, a lot of times someone would come along and they would shove it up and just push on it. Does that sound comfortable? No. And I have people tell me this, that they had someone to get the arm moving, they just pushed it in that direction and just cranked on it until it moved that way. Well, we know better than that now. We know that if we're very specific on which tissue that we're working on, that we can actually loosen it up in a comfortable position and allow more movement versus forcing more movement. So it's a little bit different approach than we used to do, but it's a lot more effective and a lot more comfortable. So I want you to be thinking what other questions you might have. Type those in the chat box, and Danny's going to be answering some of those. And while you're getting your questions entered there, I'm going to actually get everything set up. We're going to go over sleeping positions and how to put on a sweater or a jacket a little bit more comfortably. So, Danny, can you see that table in there pretty well? I'm going to move the chair out of the way so Okay, so first we're going to talk about how to put on a jacket or a sweater and be nice to your shoulder. So if I have a shoulder, let's say I have a really bad shoulder and I can't even lift it up a little. I will tell you it's easier if you make sure it's right side in first. So the key is to putting on a sweater or a coat when your shoulder is not doing so well. Maybe you're not able to lift it up or get your hand behind your back very well. What you want to do is you're going to put that hand in first. And if you'll notice, if I push this all the way up over my elbow, whether it's a sweater or a shirt, then I can bring around and I'm there and I can use my other arm to do that. If you don't get the whole sleeve above your elbow, that makes it much harder. Same thing taking that off. I can actually pull from behind with my other shoulder, or if that's a little tough, I have some people grab at the bottom and they'll actually pull it over their head in order to get that off of there and then pull it down. You notice I didn't have to move this arm that whole time. So being cautious with your shoulder, if you need to put a t-shirt or jacket on, put it on to that arm first, then bring it around, put your other arm in. Okay, next we're going to be talking about shoulder positions for you to be a little bit more comfortable while you're sleeping. So, a couple of things you want to look at. One is having a pillow. Two, you need to invest in one of these high-tech fancy pieces of equipment. This is called a bath towel. All right, so when we look at the shoulder, you remember us talking about how we might strain or pinch on things. If I'm laying on my back, if my elbow drops down to the bed, it's going to stretch across the front. So I want to try to imagine the side seam of my shirt is going to be as far down as my elbow goes. And if I'm laying down and my arm resting on the bed is farther down than the side seam of my shirt, I'm going to take a support. Whether I use a rolled up towel or a couple of folded towels or maybe a couch cushion, I can just put that by my side. And now when I rest my elbow with the support, this is basically level and it's not dropping down. I have some people who need to use a little bit larger support. If you are a larger person, one of the things we use is either a larger pillow or maybe like a little yoga block plus a towel. Something to lift it up a little bit higher and help your elbow stay up. This allows the shoulder to relax. Now notice I'm getting it under my arm. I'm not putting it underneath my shoulder. That'll push everything up, and that's not going to help as much. So having some support under the elbow can take some pressure off of there. Now I have a lot of people who say, Alaina, I can't sleep on my back. I can only sleep on one side to actually get to sleep. Well, the most important part about your sleeping is that you actually get some sleep. So if you can find a position that's comfortable for you, that's great. Now, if I'm laying down on the painful shoulder, I have to be careful about that ball jamming into the socket. That can create some problems there. So when I lay down, instead of laying down directly on the shoulder, a lot of times when people are laying down on their side, they tend to straighten the bottom leg and the top leg rolls over. This pushes more weight into my shoulder and can make it uncomfortable. Instead, keep your the bottom leg bent and straighten the top leg. When that comes down, that will allow you to rest slightly towards your back and get off of the ball and socket. That allows you to rest more on the shoulder blade and not be putting so much discomfort through there. So your tips are straighten the top leg and roll back a little bit. That can take some stress off. A lot of times people like to put their arm under the pillow like this. That cranking and twisting is oftentimes what's very uncomfortable for the shoulder. If it's the twisting component that's bothering your shoulder, you can actually straighten the arm. So if your arm is up or forward, if you straighten the elbow, then you can untwist whichever way is comfortable for your arm. So sometimes instead of it being bent, just straightening the arm. If you have a shoulder that doesn't bend back that way, but you like to sleep this way, you can't just lay down with your arms sticking up in the air all night. That wouldn't be comfortable. So just straightening the elbow can take some stress off of there. Now, if you are able to sleep on your other side, then I suggest you take a pillow or a cushion. Let's say this is the painful side now. If your top arm is the painful one, you don't want to let the arm cross what I call your armpit line. So if I'm laying down this line where I get my armpit, okay, if I'm on my side, I don't want my elbow to cross that line or I'm going to be pinching in the front. So instead, I can take that same towel and I can rest it under my elbow. Or I can put a little towel or a cushion, something to keep my arm from falling over. Sometimes that involves actually just maybe hugging a pillow or having some other support there. So those are a couple of things that you can be working on to be safe with your shoulder. Also, if you make sure that your pillow is not shoving your head out of a nice neutral position, if your neck is getting kinked at night, that can bother your shoulder as well. So sometimes it's worth taking a look at your pillow. If you have questions about pillow fitting, we actually do that with our patients about what type of pillow for your body is probably going to work best, how to set that up, and how to protect your neck and shoulder at the same time. So those are a few tips to be working on. Next, I want to show you when it comes to your shoulder. There are a lot of different shoulder problems that can be going on. So let's start with, I'm going to show you one or two things to work on for your shoulder, but if it hurts, then this is not appropriate for you. We never push into pain with shoulders. So what we look at, when I think of my shoulder, if your hands are resting in your lap, think about where your breastbone is and where your shoulder is. If your shoulder is farther forward than your breastbone, you're likely putting strain on the neck, shoulder blade, shoulder joint, collarbone, ribs, and spine. If you imagine you're taking that breastbone and bringing it up, do you see how that puts me in a little better position for unloading my shoulder and those other structures? Sometimes just coming out of a squashed position is all the exercise you need. For a lot of people from here, they then need to practice getting that shoulder blade to go down and back. Now, if you find yourself pulling the elbows back to do this, that is not the same thing, and it'll actually make your shoulder more sore. So if you have difficulty dropping that shoulder blade back on your own, that's usually something where you need one of us to get in and help the shoulder blade move in the right direction. And I'll tell you, these are not things you learn in PE class when you're a kid. So learning to take some pressure off of the shoulder or learning about your posture, it should not be super posture with your chest up and your shoulders back. It should be a nice relaxed position where your shoulders can relax into a safe, comfortable position without straining on any tissues. So if those are things that you struggle to be able to get done on your own, then those are things where you need someone to get some hands-on assessment and work on those tissues. I have a lot of people tell me that, hey, I've got a band. I'll do these exercises I learned from Google. If your shoulder is not in the right place and you do this, all you're going to do is get stronger at being malpositioned and creating more problems. So be very careful if you decide to do anything along those lines. Now, we do have something similar when we see people in a gym, whether they're doing overhead presses or bench presses, where if the shoulder blade is not fixed in a good position for the arm to do the work, they're getting this kind of job done, then a lot of times they're transmitting forces not to the muscles they're trying to target, but they're ending up in other tissues taking excess load and creating things like micro tears, labral tears, AC joint problems, and neck issues. So unless you're really excited to do those, then by all means, keep going the way you're going. But we really encourage people to take a step back, and if you're unsure or if it's uncomfortable, especially with a shoulder, we don't do the no pain, no gain situation. If it hurts, there's a problem. And with shoulders, if you try to push through it, you're more likely than not just doing extra damage. Those are all the things from my checklist. I think we covered everything we were supposed to. Let's check and see what kind of questions we've got. Okay. Oh, Wayne's got to get out of here. He had to head on out. All right, so I've got my chat box back again. Woohoo. I think the chat box disappears when I put the PowerPoint up. We're always learning new things when it comes to the technology. All right, so does anyone have any other questions that you'd like me to answer before we hop off of here? Okay, well, if you do have any questions, feel free to reach out to us. Again, Sam or Landon, they're happy to get you set up to be doing a, if you want to do the free consultation, or if you actually want to just start getting better and do a full evaluation. If it's more than just a shoulder, like we're having to look at shoulder and neck, or if you have a secondary issue of, your knee or hip or back, that does a little better with a full evaluation where we can actually get in and check all of those tissues instead of just the shoulder. But if you are one of our patients, we do offer, we have an on-call physical therapist. So if something hurts at night or over the weekend, then you've always got a way to reach out to us with a text message or leaving us a voicemail for us to get back to you. So we offer a lot of resources beyond just having a significant skill set to be able to, did you just crawl underneath the, okay. Landon does not want to be on our recording, so she just crawled behind me. Anyway, she is ready to answer your call if you would like to set up a time for that. If you do have any other questions, I'll stick around for a few more minutes, but I hope you found that useful. Did you get your money's worth? Hopefully. Great question to ask for a free seminar, right? I hope you found that information useful. We are doing one of these next week for low back pain. So if that's something that you or someone you know might benefit from, we can help get you some information there as well. So I hope you all keep taking care of those shoulders and call us if you have any questions, and have a great rest of the day.